Okay, the acid-base balance and acid-base disorders makes a very important role in the critical situations, which includes the ICU setup and also various other management of the patients when it comes to the case. Okay, so without much introducing this topic, so we will be only focusing on majorly the approach, how we are going to approach an acid-base disorder report or how we are going to interpret the reports. Because we also know that during your first year examinations and also in the NEET exam, they'll most commonly ask you the questions where you have to identify what is the primary disorder of the acid-base balance, whether it is acidosis or it's the alkalosis. So like that, there will be questions. Okay, it can be MCQ question or in the exams theory question, how it is regulated. So we'll be basically seeing today how we are going to approach if we get the acid-base disorder case or acid-base disorder patient. So when we are seeing acid-base chart, we should always know what are the normal values before we start the interpretation. Okay, and we should interpret always in this sequence only. What is the sequence? Whenever a report is given to you, okay, what we are seeing now is how we are going to interpret. Okay, how we are going to interpret the reports of acid base. Basics I will tell you. First, always you see the pH so that you can identify is it acidosis or alkalosis. First. Second, you see the parameter called as bicarbonate levels. What is the level of bicarbonate? Is it decreased or increased? Third, you should see what is the level of carbon dioxide, which is nothing but indicator of carbonic acid levels. So is it increased or is it decreased? Now, fourth, you see whether there is compensation or not. So this is very basic. You have to see four things in any acid-base disorder. First, you assess the pH so that you can tell is it acidosis or alkalosis. Second, you see the bicarbonate levels. Always don't jump and see carbon dioxide levels. I'll tell you why. Okay, I'll tell you next why. Always see second component in the acid-base report is always bicarbonate. If bicarbonate is fixing with the condition, well and good. Not fixing with the condition, then you see the third component, that is the carbon dioxide or partial pressure of carbon dioxide, which is indicative of the numerator component of the ratio, which is the carbonic acid. Then fourth, you see whether the compensation has started or not. What is compensation? It is the response of the body for the primary change. Okay, response of the body for the primary acid-base disorder. So we'll see some charts. Okay, we'll see some examples. With that, we'll be winding up for today's session for approach. Okay, so before we go, we should know what is the normal pH. So pH is 7.35 to 7.45. What is the normal partial pressure of the carbon dioxide? That is 35 to 45 mmHg. And what is the normal bicarbonate level is 22 to 26. Okay, we are taking this reference range. Now we come to the case number 1. So here we are seeing a patient comes with the acid-base status of pH 7.4. Now we should know, is it in the normal range 7.35 to 7.45? Yes. Yes, it is in the normal range. Should we stop there? No, because we have learned one more thing called as complete compensation. Right? In complete compensation, what happens? Acid-base disorder was there, but today it has corrected by itself. So pH will be in the normal. So don't get confused if the pH is in normal. Always see the other components. I told you whom you are going to see next. Second, we are going to see bicarbonate. Is it in the abnormal range or normal range? It's in the normal range, 22 to 26. Third component you see. Is it carbon dioxide normal in the range 35 to 45 mmHg? Yes, it's in the normal. So definitively this person is not at all having any abnormality. His blood pH is normal. So what is our comment? Our comment is this report is completely normal. There is no acid-base disorder in this case. Okay, so this is how we are going to approach the next ones also. We'll see the second case. So that is about the now second case. Second case, the following lab investigations of the assessment of the patient. And what we are seeing first, I told you pH. pH 7.35 to 7.45. Is it in the normal range? No. It is decreased? Yes. If it is decreased, what we call it as? Acidosis, sir. Okay. Understanding? Okay. If pH is less than 7.35, we call it as acidosis. Now, acidosis is there. Who is causing it? Is it metabolic or is it respiratory? That we are going to see next. I told you second component we have to see is always bicarbonate. Bicarbonate 15. 22 to 26 is normal range. Is it decreased? Yes. If base is decreased, will it cause acidosis? Yes. So who is the primary cause for this? Is the bicarbonate. Okay, the primary cause for this is bicarbonate. So what is the case? Metabolic, because it is a bicarbonate, it's a metabolic acidosis. Now you see the third component, carbon dioxide. Okay, I told you ratio, HCO3 to H2CO3 ratio. Now we know primary defect is decreasing bicarbonate level. So what should be the compensation? It should always go in hand. Compensation is always in hand with the primary defect. Primary defect is bicarbonate. So carbonic acid or carbon dioxide levels also should decrease. Now you see carbon dioxide levels. Is it decreased? Yes. From 35 to 45 is the normal, but it has reduced. It is going in hand. So the body has started the compensation. It is compensating. Now we come back to the pH. Compensation is there, but is it pH is in a normal range? It's not in the normal range. So compensation is the decrease in H2CO3 levels. Also, we can term it as if there is decrease in carbonic acid levels. Okay, what we call it as respiratory alkalosis. Okay, we are reducing the concentration of carbon dioxide. Compensation is respiratory alkalosis. Is it partial or complete? Because still pH is out of normal range, so it is partially compensated metabolic acidosis. So this is the second case. The third case, we are going to see lab investigations, that is 7.5. So it is more than the normal range. So it comes as alkalosis. Okay, it's a condition alkalosis. Now we'll see whether it's a metabolic or respiratory. First is pH, second is bicarbonate. If base is increased, here it is increased more than normal. If base is increased, will it cause alkalosis? Yes. So what is this case? This is a case of metabolic alkalosis. For example, instead of bicarbonate, if you see carbon dioxide levels, carbon dioxide is increased means it should become acidic condition, but it is not going in hand. That's why I told you, you should never see carbon dioxide second. It's a bicarbonate, you should see second. Then you see carbon dioxide. Is it in the normal range? It is increased. Now, before we tell it is compensation is present or not, we have to again put up the ratio. So primary defect, increase in bicarbonate. What is the compensation? Compensation also should go in hand. Is it increased? Yes. So there is compensation present. Compensation is there. By what? Increase in carbonic acid levels. How? We can tell it as respiratory acidosis. We can increase the carbon dioxide levels by respiratory process only. Now go back to the pH. Is it in the normal or abnormal? Abnormal range. So is it partial or complete? It is partial. So it's a partially compensated metabolic alkalosis. This is the case. Third. Now fourth case. If you see the first pH 7.25, it is less than normal. So what is the condition we call it as? Acidosis. Third, you see the bicarbonate levels. What is bicarbonate levels? It's in the normal range. There is acidosis, bicarbonate is in normal. So acidosis is not because of bicarbonate. Now you see third component, carbon dioxide. Is it increased or decreased? Increased. Increased carbon dioxide means it causes acidosis. Acid is increased. So what is the cause for this now? Respiratory, because the carbon dioxide is maintained by respiratory process. It is respiratory acidosis. Now you see compensation. Compensation, who will do? Now this was the ratio. H2CO3. Primary defect is what? Because of the increase in carbonic acid level. What should be the compensation? Bicarbonate should increase. Now you see what happens to the bicarbonate. No, it is in the normal range. So there is no compensation yet. Okay, there is no compensation yet. So we cannot commit it is partial or complete because it's not compensated respiratory acidosis. So that is about the fourth case. Now fifth case, we'll see. First we see the pH to tell it is acidosis or alkalosis. So we'll see first it is a acidosis because pH is less than normal range. Next, we'll see bicarbonate. Bicarbonate is normal or increased? It is increased. Now bicarbonate is increased and there is acidosis. They don't go in hand. Increase in base should cause alkalosis, but here it is acidosis. So it is not the bicarbonate who will causing acidosis. Then you see the third component, carbon dioxide. Carbon dioxide is elevated. So when there is increase in carbon dioxide, what happens to the condition? Yes, sir, it causes acidosis. So who is the primary cause here now? Primary cause is respiratory. Okay, respiratory acidosis is the primary cause. Respiratory acidosis is the primary cause. Now we want to see compensation. If we want to see compensation, when numerator is increased, okay, when denominator is increased, numerator also should increase. Bicarbonate is increasing. So there is compensation. Okay, how it is compensating? By increasing bicarbonate levels, nothing but metabolic alkalosis. Okay, it is causing metabolic alkalosis as compensation. Is it partial or complete? Go back and see pH. Simple. pH, is it come to normal range or it's still in the abnormal range? It's in the abnormal range. So it is not complete. It is partial. Okay, it's a partially compensated respiratory acidosis is the case. Okay, that is the fifth case. And last case, sixth case, that is patient report. First you see the pH. Is it normal or abnormal? It is increased. So it is a alkalosis. Case of alkalosis. Then you see the bicarbonate levels. Is it in the normal range? Yes. Okay. So alkalosis is not there. pH, this is in the normal range. Now you see the third component, carbon dioxide. What is it? It is reduced or increased? Reduced. So when acids are reduced, what happens to the condition? Alkalosis. So what is this condition is? It is respiratory alkalosis. Because alkalosis is due to because of what? Decrease in the carbonic acid levels, carbon dioxide decrease. So now you see compensation. Bicarbonate, is it in a normal range? Yes. So there is no compensation. So when there is no compensation, there is no comment on partial or complete. So what is the case here now? This is an uncompensated respiratory alkalosis. So this is about the various cases, how to understand the concept or approach to an acid-base disorder. Okay, so with this, we'll be concluding, and I hope I have cleared very neatly, and also I have made it very simple to interpret how acid-base disorder can be identified, whether it's a metabolic or respiratory acidosis or alkalosis condition, and what are the steps you should follow when you are interpreting them. So always see first pH, second bicarbonate, third carbon dioxide, and fourth you should also see is the compensation. Apart from this, what we have to also see is something called as anion gap. Okay, so I would ask you to go back and read about anion gap, which is the important question. So with this, we are going to conclude for today's session that is on acid-base disorder approach. Thank you very much for your listening. Thank you all.